If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you.
Okay, welcome everyone to Health Further. We have a guest host today. Marcus is out traveling the world. We gave him a couple of days off. Paul Kappelman, thanks for coming back to the show, returning guest host.
Yeah, it's good to see you, Vic. I'm glad to be here and hope Marcus is having fun, and it's good to be back. It's been a little while.
Yeah, so we were going to start off, we have several stories to talk through, but before we do that, I just wanted to get your thoughts on kind of the state of the healthcare world, kind of where are we and where are we headed? So maybe talk through your view a couple of years in, maybe a year and a half into the Trump 2 administration. How are you seeing access and affordability and policy? What are you seeing the changes as?
Yeah, well, thanks for asking that. And I listened to your show 200, which I thought was a first of all, congratulations on 200. Nobody thought you'd make it to 200.
Yeah, no one thought we'd make it to 3.
But I mean, that's a pretty good milestone. But I thought you and Marcus did a nice job of sort of summarizing where we were and some of the issues. And I thought maybe it would be good time to sort of step back and sort of say, as a consumer, not as a provider, not as an investor, but, you know, as an average American person, you know, experiencing the healthcare environment, you know, how's this administration done? Where have they done well? And maybe give them some grades. And the reason is because there's so much discussion about what's next with healthcare. You've got the DSA candidates who are campaigning on Medicare for all. You know, is that a possibility? And I think part of it is they're capitalizing on American sort of anger with the status quo, and you know, some of that's healthcare, clearly, and the status quo of healthcare and the cost of healthcare. So I thought we may attack that.
Yeah,
So,
well, and the pace of change. I mean, Trump definitely has come in kind of guns blazing with lots of change, and so I think it's useful to look back and instead of talking about one policy at a time,
right.
like talk about the last 18 months or what are the macro things there.
So when you think about what consumers care about, I think we listed some of them. So let's start with access, right? They want to be able to find a provider, be able to get into a provider in a reasonable period of time, have their local hospital be able to accommodate their needs, stay in their local communities and get care where they live. That's a pretty basic sort of American, people feel is a right to have healthcare in their communities. I think clearly, you know, between coverage, whether that's Medicaid enrollment or access to the exchanges, whether they be subsidies or just regular affordability of my plan, people are finding it harder to access care. And I think you guys hit it. We are going to see more closures of facilities, hospitals and others, physicians limiting their panels, maybe not taking Medicare, Medicaid, because of the increased uninsured and therefore bad debt. So you guys hit it on the nail. Hospitals are going to still have to see those patients regardless of whether they have insurance, which means negative margins and challenges. And you're going to see more hospital closures in the coming years as HR 1 flows through. So I think on access, it'd be hard to give them any grade above a C or a D, probably a D. And I think that, Americans are feeling that now, and I don't see that getting better during this administration. I really don't. So, access.
And you talk to a lot of health system operators. What are people doing out there to prepare? I think early 27, we're going to start to see the real impact to, so the revenue lines. Have you heard any creative ideas or other, maybe mergers that are going on that maybe don't share the details, but is that talk going on?
I do think there's more talk of consolidation, right? I was surprised that over the previous 4 years, kind of coming out of COVID, that there weren't more consolidations. Maybe that part of it was the regulatory environment. So I do think that piece of it has laxed, and I do hope that these hospitals and providers are able to stay, and that, a merger is much better than a closure. Like we talked about that before, right?
Yeah. Getting
through the FTC hoops to say, no, you can't do that. And then the outcome is the hospital closes when they could have merged with a large system. That's a negative outcome for that community. So even if you're concerned a little bit about prices increasing or not, having your local hospital open is better than it being closed. So yes, I do think there'll be some consolidation. As far as what the health systems are doing, you look at HCA, who I would consider to have probably the least impact of uninsured and bad debt because of just their markets that they're in. They don't have high Medicaid, uninsured, underinsured markets, and they're feeling the pinch. I think what health systems are going to have to do, whether they're doing it effectively, is they're going to have to use technology to focus on their costs to get more efficient. They're going to have, if they don't have incredibly efficient revenue cycle operations today, they're going to have that because every dollar counts. And so when you're struggling to collect dollars that are harder, right? People's deductibles are higher, more out of pocket. They don't have the coverage. You're going to have to be incredibly creative about how you collect and how you work with patients to collect. So improve revenue cycle operations, efficiency, using technology on revenue cycle, and then continue on the cost side, right? Still today, there are lots of opportunities for hospitals to get more efficient. And those that are, taking that seriously and getting more efficient are going to be able to offset some of these revenue impacts. Those that don't are going to see margin deterioration.
Yeah. I mean, I think what I'm hoping, but it's a lot of change in a short amount of time for health systems is they're going to have to get more efficient delivering care and then increase the volume of patients they see because the per procedure rates are coming down.
Yeah. When you look at it overall, when you combine sort of the full payer mix of uninsured, Medicaid, Medicare, the underinsured is going to absolutely have its underinsured going to have its toll on health systems. And that's going to be hard to make up with cost, but you have to. And hopefully that's back-end costs, efficiency using technology and not, decreasing manpower at the bedside, because that's not good for care. And many systems can't do that, right? They have regulations that they can't do it, and they're struggling to keep up with the care and find the technicians and the nurses today. So it's really going to be about how do we cut costs on the back-end systems, cut out the waste. And there's still plenty of opportunity in our system to do so. So that's access. I think it's a D-. It's really concerning. And I think health systems, one of the things they will do is they look at product lines that are less profitable. And those that usually are less profitable usually serve some of the underserved communities or high-end care. And they decrease those product lines. So it may not be that a hospital closes, but it could be that a regular community hospital decides we can't afford to cover OB services. And therefore, that community is going to have to go to the major city to have their OB service, or I'm going to not be able to afford to have my NICU or my burn. So, some of that stuff we don't see as much because unless you're in that local community and seeking that care, you may not hear that their local community stops.
Yeah, the building with the sign on it is still there. The hospital is still there, but they don't have OB. They don't have NICU. Maybe they don't have ICU at all. They're cutting back the service lines.
That's right. So access, I think it's a D. Affordability. And I think of affordability as what does it cost me for my plan to have healthcare, right? And so, and whether if that's through your employer or through the exchange, those premiums skyrocketed. And I just read an article today. We didn't get in here, but it was an article from Aon saying, premiums are expected to rise 10%. So on top of 14% last year, 10%. I mean, that is tripling the rate of inflation. Again, so nothing we've done to curb that. Now, that's not to say that other administrations did a great job in curbing that either, but it would have been that could have been a big win if there was some things we can do to control that level of cost increase year over year. Because you think about an average American, if it's costing them $1,000 or $1,200 to go out and get insurance on the exchange, and they're making $50,000 a year, $60,000 a year, you have no other choice but to say, I'm going to take risk. You cannot spend 50%, 60% of your income on your health insurance plan because you have no room for any other expenses, house, car, groceries, et cetera. So
yeah, unless you have chronic disease and your expenses are going to be more than that. And so I think systematically people will go uninsured unless they are really high risk, high cost. And so the risk pools of these insurers are going to get worse and worse as well.
Correct.
Which then drives premiums next
Which
year.
drives, right. So that cycle, again, not an easy problem to fix, not one that others have fixed either, but certainly we haven't seen any progress on sort of my day-to-day affordability of my plan. I think when you switch to sort of policy and regulatory, taking HR one aside in the big, beautiful bill, right? I think there's been some positive things that have come out. I think, the FDA was making some progress. We'll see what happens with the new administration there. But I'd probably give it a B. There were some things that I think decreased regulations made it easier. I do think what we talked about with FTC and maybe the merger environment hopefully is a little improved. So a B when it comes to policy and regulation. Same thing with innovation. Go ahead.
Yes,
Go ahead.
shift to innovation and new care delivery models, new approaches.
Yeah, we've seen a lot. And I think the fact that we're going to talk about a story today where we're looking at, AI delivered devices and the administration looking for comment. I think there's been a willingness to look at these devices and therapies that are more innovative in nature. And, I think that's been positive and refreshing. And we've seen some nice things come out on cancer and vaccines that I think are positive, that they're moving through the FDA in a timely manner, and we're starting to see some innovation. What do you think about that?
Yeah, I think the FDA's openness and sort of willingness to listen to the community and think about how should we approach this is really positive. And innovation in general, I think the price transparency mandate and sort of continuing to push that through, it's slow, but as a venture capitalist, I think that's great to have prices available where you can actually see them, allows for not so much consumers, but for new startups to enter a market where maybe there's not as many diagnostic tools, and you can see that, and you see the effect on pricing, and then you can enter that space. I think over a 5 or 10 year horizon, that could make a big difference, but it's slower than anyone wants.
Right. I think it's hard to argue against transparency. I think the question is, in the scheme of things that could positively impact the total ecosystem of healthcare, is it really going to move the needle for the average consumer? I don't think so. I mean, so much of where we go is mandated by our health insurance today, and people don't shop. I mean, very few people will have the ability to shop. So is it good? Of course it is. Is it going to move the needle? Maybe long term, but compared to other things and other issues, it seems like they're very focused on that, a lot of effort, because it's a hot button issue, but I don't think it's going to move the needle a ton. And new care delivery models, sort of innovation, not much there. Not much has changed from sort of the old administration when it comes to sort of innovative models that are really driving it. Tweaks around the edges on some of the things related to accountable care organizations and pilots related to bundled care, but nothing that I think is going to move the needle. So, I give it a solid B there when it comes to policy reimbursement, and probably B on innovation as well. And then total cost of care. So not necessarily what it costs me as a consumer, but as I look at a person and how their total cost of care for their lifetime, have we done meaningful things to improve the cost of that person over their lifetime? Do I think that the MAHA initiatives around food are good? Yeah, they are. They're positive, and I'm glad that they're doing it. Sort of balance that with some of the vaccine stuff. Maybe it offsets it a little bit, but haven't moved the needle. I don't think there's been anything revolutionary, nor do I. It's only been a year and a half. Do I see anything coming down the pike that says, we're really going to go after population health and total cost of care? Not seen anything that gives me optimism that we're going to attack that in this administration's tenure. So overall, it's not a great score, I think, is the bottom line. There's not a lot of optimism as a general healthcare consumer that things are going to get better in the next 3 years when it comes to those major issues. I think we're nibbling around the edges on some hot topics, but they don't have an impact on, my day-to-day experience as a consumer. That's my take. I don't know what you think.
Yeah, I think that's probably right. I think, and we're seeing it in at least the predictions for the midterms. People vote around healthcare issues, and so I think there's a challenge there for this administration. Whether the other side would make a big impact, I don't know, but they're definitely going to go in a different direction.
Yeah. Well, I think what it sets up for is the question of how viable is Medicare for all? How realistic that's going to happen? I would say you take the anger around prices, right? And just affordability and the economy for the average American, and you layer on top of that the challenges with healthcare, lack of coverage, premiums increasing, and 3 more years of that, or 2.5 more years of that. Could it set up a scenario where the American public is angry enough to support Medicare for all? I think it's got more probability than it's ever had in our lifetime. And I would say My guess is it's got a chance. Maybe that's 51-49, but I think it has a real chance. And I think there's no reason for incumbent Democrats to jump on board at this stage. They'd be playing their cards too much. But on the edge of an election, maybe we'll see. I don't know what that all means. We could spend a whole show of what that looks like and how good and how bad it is. We all have our opinions. I'll make one comment. You always see when you hear about it on the news, like, yeah, they're going to take away your plan. Well, who's happy with their plan? Like, that's what, like you say, like your plan, if you're happy with it. Well, like, I mean, based on the news over the last year and a half, people's acceptance and happiness with the health administration industry is at an all-time low. So not many people really are happy with their plans.
Yeah. I mean, I'm not sure that Medicare for All will be a magic solve that makes everything better, but I do think voters are wanting change in any form.
Right.
And so I think there's a lot of momentum around that. We'll see what happens in the midterms, but I think there's a decent chance that you're going to have Democratic Socialists with a lot of momentum, a lot of electoral power, and then we'll see how it plays out.
Well, that's exactly right. It's not necessarily that they understand it and then the ramifications of it, because it's very hard to understand, but it's anger and the want for change.
Yeah. And I want something new. And this
isn't working for me.
Before it's enacted, will sound good. And so people want change.
Particularly if you have no coverage today or you're facing a healthcare crisis that you know is going to put you into bankruptcy, the alternative, it sounds pretty damn good. Well, anyway, that's right, thank you for indulging me there. It's not exactly positive, but I don't think the healthcare landscape is overall positive, with some hot pockets of, some really good news and some innovation and technology and AI helping advance those things. Those are the positive things. And I'm glad to see that we've got some momentum, but overall, day to day, I'm not sure that affects most Americans.
Yeah, I agree. Okay, well, let's dig into the news this week. Okay, yeah, the Wall Street Journal, this was last Friday. Retail sales fell this month. So people are shopping less, fell 5% from the previous month. And so I'm going to kind of run through a couple of these stories and then we'll come back and talk to them. So retail sales were down. The Fed released its minutes from the last meeting, which was about a month ago. And there was a lot of dissent. There were 3 votes to raise rate. There's a lot of people worried about inflation at the same time that we are, it's only a first data point in retail sales, but clearly a worrisome sign about the economy contracting. So raising rates in that environment, I think would be kind of somewhat worrisome. And then the U.S. debt hit 40 trillion. And if you look at it as a percent of GDP, which I think is probably the better way to look at it, although 40 is, of course, a big number, 40 trillion. It's a lot of money, but it's also, over 125% of GDP. And so this is from the New York Times. The Wall Street Journal had it at a little like 110, depends how you measure it kind of, but either way, it's a lot of national debt. So what are your thoughts about the economy overall? Because that flows through healthcare and reimbursement and everything.
Yeah, well, certainly the retail sales falling is not a good sign. It's 1 month. I wonder, particularly if you think about the average American and the economy and those people and are they choosing to spend money on discretionary items? And this is sort of our first warning sign that people are concerned, because spending had been pretty solid despite a lot of different things, gas prices, et cetera. We can surmise to what is that? Why now are they sort of choosing to spend less on retail items? Maybe it's the permanency of the war. I don't know that could have an impact, that this isn't going anywhere, but I think it's going to be one to track, right? Certainly if you see this continue, it's going to be a worrisome sign.
Yeah, certainly. The war is going to drive gas prices up. It already has, and that eventually, one would think, would flow through overall economy to have inflation up. But the economy is not really strong enough where it is something that I think would make sense to raise rates. So yes, and then we have all this debt. And as you know, but I'll just say it out loud, the rates being up on such a huge number, the interest payments of the U.S. then gets more and more and more continuously.
Yeah.
Okay, we'll move into venture capital. So Happy Health raised $75 million to support home-based care. Really interesting. It's an FDA-cleared smart ring for at-home diagnosis of sleep apnea. Sleep apnea is, typically you have to go to a sleep lab, pretty limited capacity for that. Good to see Arch Venture Partners and Open Loop led the round. What do you think of Happy?
Yeah, not a very user-friendly experience for going to a sleep lab, or a very sterile environment. You're in a hospital bed, got somebody there, equipment. And so if that can be done with a device that's different from Aura, right? Aura tells you sort of how you're sleeping on a day-to-day basis. This is a diagnostic tool. That's a positive thing. If that can be done at home, versus having to go in, that's great. And it just improves access. And we all know that, sleep is critical. So good to see it. It'd be nice to see some of these devices sort of be able to do everything. So you're not having 8 different devices that you're going to be wearing.
Right. One ring on for one thing.
Right. The heart monitor on for, because, obviously Aura does a lot. Apple Watch does a lot. You guys have talked about that, but they're not diagnostic. And so, hopefully we get to the point where maybe there are 1 or 2 devices that you can wear that do a lot of different things, but it's a positive sign. Good for them.
Yeah. Okay. And then we have Craif, I think is what it's called, maybe, raises $33 million to boost its work on a urine test for cancer. So this is screening for pancreatic cancer.
Yeah. For those that don't know, pancreatic cancer is, if not the deadliest, one of the deadliest cancers. Just once it gets to an advanced stage, the ability to live long afterwards is really low. Yeah, so it's a tough one. So clearly, early detection, there is a chance that you can get it early where it has not spread and be able to take it out surgically, which would then increase rates dramatically. So anything that improves early detection is positive. And it's also positive that you're able to have signal in urine for other types of cancer markers too, that, maybe that's a better way, an easier way than blood tests. But yeah, good to see this one.
Yeah. Then in MedCity, Align Marketplace raised $20 million for Advanced Primary Care Marketplace. Venrock led this. What did you think of Aligned?
So I think I understand this model. It's a workplace primary care / network model, but it's one that is sort of designed for companies that may not have a corporate headquarters in New York that's all their people, that may have a dispersed model, and so sort of a marketplace of primary care to sort of fit in this. I personally really like the at work primary care model, because I'm a believer that one of the ways we get at total cost of care is by improving our primary care system, access to primary cares, and empowering them to do the job that they do, which is be the quarterback, right? To help improve total cost of care, not just see you at your annual physical or deal with an episodic, but help you quarterback the care process efficiently, effectively. So I like this. And I think that, A, it's a good model. B, I also think that the way you get at costs, which was one of the other things, is the employers are going to have to jump into this all feet, because they're the one paying the bills, right? Outside of the federal government, It's the employers that are at risk. The Uniteds of the world, they're not at risk. It's the employers. They have to jump head and feet into this to make a dent in affordability.
Yeah, and 10% premium increases on 14% year before. It's been, really significant increases every year. This is typically the first or second biggest line item on the income statement from an expense point of view, and it's growing at, as you said, 3 times the inflation rate. Eventually, employers are going to have to pay attention and try to take action. And primary care is, I agree, is probably one of the easiest and most employee-friendly ways to do that, as opposed to changing the benefit structure or limiting the network access or other things.
Right. They're at least making a proactive attempt to bring down costs based on changing behaviors and access to practice. I think the missing piece is employers are going to have to be a little tighter on mandating that people use these services and they comply. Many employers have been very hesitant to sort of have any teeth in these programs. They sort of have all carrot, no stick. And, we're going to have to change our behaviors in order to get at costs. And part of that is being compliant with, going to see the primary care, listening to the primary care, staying on our meds, those things. And so, but I see these are positive things.
Yeah, definitely. Okay, moving into policy. So Trump named a new director of the FDA, Dr. Heidi Overton. And so she is pretty tight with the exiting director, Marty McCary. And so I think will be similar to his thought, but Dr. McCary and Trump got sideways on a couple of different things, and Dr. Overton is now the new chief. What do you think of her?
Don't know that much about her other than, what's been written. So I don't think there's much to think that she's going to be revolutionary. I think she's brought in to sort of toe the line on the administration stance. It was interesting in this article. I had not heard this before, and it may just be that I didn't read it. Was kind of the straw that broke the camel's back for Marty was this issue around flavored vapes. I don't know if you if you knew that or heard that, but I hadn't heard that.
I didn't know that too. I read it in this article too. Trump played golf with some vape industry experts, and then all of a sudden, they were no longer regulated.
Right. Now blueberry's fine, right? So, Apple's not, but blueberry is. And I think whether that's true or not, it's interesting. But it points to sort of the tension that an FDA commissioner is going to have with the administration, right? Is it political? Is it his desires, or is it, science-based and getting through technologies and being efficient? So I hope she can continue, the work that Marty did on trying to be more efficient to bring the department up to standard. Because he walked into a mess, right? I mean, it's years and years of neglect that have nothing to do, plus a pretty major layoff in resources. And so I really hope she's got the chops to be able to continue that work and balance, Trump's desires and the administration's desires to what's the right thing to do for science.
Yeah, it's a hard role to be in, but I'm hopeful there. And then Rick Abramson, who's a friend of the pod, he's been on Health Further before. He's now serving in the FDA in their device strategy. He put out for feedback sort of new guidelines for how we would regulate generative AI-enabled devices. And it's a long document, but I'd encourage the listeners to check it out. He's looking for comment, and I know Rick, he is going to read the comments and wants to try to work with us, work with industry to get it right. So there's a lot to this, and I think people should dig into it, but good to see that the FDA opening up and sort of looking for comments.
Was this focused on any one area, Vic? Was it, more radiologic stuff? Or was it just sort of wide open in general, looking at AI-enabled medical devices? Was there any specific areas he was focusing on?
I mean, I think there's a couple pieces of the proposal. The first is sort of I guess maybe it's like a new way to sort of think about the pre-market with instead of the exhaustive early testing in a device that's using AI that, of course, by its nature is evolving and changing as the industry does. This would be more of a I guess I'd call it a sort of a testing to make sure it is safe, but then much more focused on post-clearance monitoring. So after we release it, this ongoing testing and monitoring and evaluation. So I think that's probably the biggest shift, but there's a lot of aspects. I mean, it's a whole new maybe environment of how you would assess devices in the post-AI world. And so I think it's worth probably an entire show on that. But I think it's good to sort of have a comment period where people can read it. I'll put it in the show notes, and then Rick's looking for comments and feedback and make it better over time.
Yep.
Moving into payers. So in Beckers Hospital Review, Medi-Cal plans brace for the title is Devastating Asset Limit Crunch. So in California, which is probably one of the more friendly Medicaid states, they are setting a limit for your net worth or assets for two people to be at $31,000. So we were joking earlier, if you have if you own a car and a surfboard, you probably have more assets than Medicaid allows. And so that you can't get coverage if you have assets over $31,000. So what did you think of this story?
Yeah, I think it's a reminder for people that, and it makes sense that there are asset laws, right? That in order to be eligible for Medicaid, you have to make under a certain amount of income, and that differs, which is technically a percentage of the poverty level and it's gone up a little bit, but still not a huge amount. But also there's asset limits, which makes sense, right? If I lose my job for a year and I don't have coverage, I can't go to the Medicaid office and get Medicaid. They're going to look at my assets and say, sorry, you can sell some stocks or do this. Right. So it makes sense. The question is, what's the limit? And that I guess that hit us pretty strong. The 31,000 just seems like pretty challenging. And I think this article highlights really, some of the disabled folks who don't have the ability to earn, who may have a nest egg and are blowing through their nest egg to be able to, care for themselves. So it's challenging. And I think it does highlight, if California, one of the more generous places, is having issues, then that's a sign. And it's,
and it's being lowered from $130,000
huge
to 21 for a single person,
an 84%
for a married.
cut.
Yeah, right. Huge cut. And I think it's because probably they need to, California has its own budget challenges, so that they sort of have to find a way to limit access. This maybe is one of the more fair ways, but it's going to be challenging.
It's going to be painful. Yeah.
Okay. Costco is moving on to sell Medicare plans. So they've had pharmacy for a long time, but they're now going to be offering insurance. What do you think about that?
Well, they couldn't have looked at what's happening in the Medicare market and said, this is a good business, right? So that's not it. This is an attempt to sort of be the end all to their customers and keep them in the stores. And if they're using them for coverage, they're able to drive compliance with their pharmacy, with other products. And it's probably a good business decision in total, but it's very interesting that they would decide. Everybody else is getting out of it. We have stories that, people are dropping. Yeah. Even in this show, we're going to have a story about that. Yet Costco has decided it's a great idea to get into it. So we'll see.
I think Costco has a very different view than every other insurance carrier out there, right? They're trying to create value for their membership dollars. So you pay that $100, whatever it is, $100 a year to be a member. And then you get access to all of the things Costco has. Now they added this in partnership with Scan Group, which is a good, mostly California based, but right. I guess they have a nationwide platform. So interesting. I think the consumerism of health is definitely continuing. I don't know what the quality of these plans is going to be, but
more choice is good, right? I think we're going into October. Right. We're going to see. My assumption would have been we were going to have less choice than we would in prior years based on some of the plans getting out of Medicare Advantage. And so, adding a new player is a positive thing for the consumer if they do it well, which they partnered with a reputable group. So hopefully it's a solid offer. And I think they're going to pilot it, right? It's not going to be in every market. So they're going to see how it goes.
Yeah. Yeah. They have 3 markets to start with. That's right. Okay. Yeah. So this is the story you were in Healthcare Dive. Providence Health Plan is closing after they attempted to sell their Medicare Advantage part of their payer, but that fell apart and they were not able to sell it. So Providence, is probably best known. Their biggest platform is their health system, but they entered into this payvider world, which I used to think was the model that everyone was going to move to. And we were talking before the show that it's a really hard thing to execute, the payvider. There's not that many groups left standing. What are your thoughts about Providence exiting?
Yeah, I think the story in and of itself is not that surprising. Probably unfortunate. They tried to be sort of all encompassing. I think the bigger outcome is what we discussed earlier, which is this is really hard. There's just very few integrated health systems who have the ability to pull this off, and it's both size, scale, technology, expertise when it comes to people who understand the insurance market versus provider, taking care of patients. And with the exception of Kaiser, There are a handful that are successful, and how successful they really are is hard to know, right? Because it's wrapped up in the whole system's sort of profitability, and it's one part of it, and they do it because they want to take care of their populations and garner market share. But the business in and of itself is probably a loss leader for most. And I just think I've thought this for a while. This isn't the answer, right? The answer is not health systems taking care of populations in their totality. Population health in and of itself makes a lot of sense and care, but I don't think health systems are equipped to do it in all but a few cases. And I think this is just evidence to that.
Yeah. Yeah. The thing that I started thinking about today, I need to give it more thought, but I mean, Kaiser's in a lot of great markets. They're very well run, and they've been doing this pay model for decades. And so they may be unique in a lot of ways, but one thing that I'm just started like noodling with is they're pretty much all in. I mean, I think if you're going to be a Kaiser member, you're going to go to Kaiser doctors, you're on the Kaiser plan. You can't go to the Kaiser facilities and have some other insurance carrier in most markets. And that kind of like all in, this is how we do our business, I think creates a lot of opportunities where if you're trying to, work with several payers as a health system, and then you add your own payer, I don't know if you get those same kind of advantages.
Yeah. Well, Kaiser is an insurance company with hospitals and providers. Providence is a health system with an insurance platform. And that I think is the difference. And the others who are the pay providers are the same, right? I mean, even players that have been in the payer world for decades, like Baylor Scott and White, are struggling to balance the two. And Baylor Scott and White is pulling out of certain plans in certain markets. It is a very challenging thing to do. And I think health systems have many of them taken the approach that, we're going all in on population health. And in order to do that, we have to have an insurance plan. And in order to that, we have to be on the exchange and commercial and Medicare Advantage. And it's incredibly challenging. It's challenging for the insurance companies, right? They've had their ups and downs with Medicare Advantage, and it's even more challenging for a health system.
Moving to the kind of novel therapies. So Moderna had big news this week. Their stock doubled from a pretty low base. They've been suffering recently, but they have an mRNA cancer vaccine for melanoma. And I think it is for, you have metastatic melanoma, and it is controlled with Keytruda. Keytruda. And this vaccine helps it from not coming back. That's the value. What do you think of this breakthrough?
Yeah, so Keytruda, one of the most popular and most used cancer drugs because it does prolong life. It's not a cure, and it doesn't it doesn't take away the cancer, but it does prolong life significantly, but not years. Many times it's months, and it's slowing the disease progression, not necessarily taking it away. What they did here is they did a study with people on Keytruda and then people on this vaccine and Keytruda, and found significant improvements. And so that's positive. And I think it's most positive that they were able to take a patient's mutated cells and use mRNA and give them a vaccine that sort of fix that. But it didn't, it doesn't take away the cancer, but it does slow the growth. So it's a positive step. But I think when people hear vaccine, they often think of, give me a shot and I don't get it kind of thing. And that's not what this is.
The vaccine label is not exactly used in the way I think about it, or most people think about it in this case. It is much more like another oncology treatment, like
immunotherapy.
Any oncology treatment, it extends life. Yeah, exactly.
It is. I think the difference between this and sort of immunotherapy is that it's sort of patient specific, right? You're taking out the mutated cells, engineering them, and then infusing them back in, and that's changing it versus, when you give Keytruda, it's an infused drug that doesn't care who you are, right? You're getting the same drug, and it's sort of a blanket approach, and it's changing you. So yeah, it's positive. Whether this is that much of a breakthrough, we'll see. But I think people got really excited about the science and the vaccine label. So good thing, but it's not revolutionary at this point, but it's a step in the right direction.
Yeah, I agree. In Gizmodo, we have this story, which is a great title. An exercise pill just cleared its first human test. And so NVIDIA announced a phase 1 trial where if you take this pill, it mimics the body's response to exercise, which is great. I don't have to work out anymore. I can just pop this pill, NVIDIA, and then go eat my Cheetos.
Right.
What do you think of this story?
I just think of the Jetsons is what I'm thinking about. Like, the Jetsons where you just took a pill for everything. So, I don't know what to think about this one. So, it's it feels like it's maybe a step down for people in GLP-1s, right? That's one of the challenges with GLP-1 is, can you stay on this, and what happens when you get off of it? Do you gain back all the weight? And are you exercising? I don't know how it replaces exercise, but maybe it's a step or an adjunct to exercise, or for people that absolutely can't or won't, it's better than nothing. Interesting. I think people should read this article. It's short and make their own minds up.
Yeah, we have GLP-1s to lose weight, and now we have this to not exercise. And keep it off. We're headed in a convenient direction, but I'm not sure in the long run it's good for whole health. I don't know I have no idea the side effects. I'm not trying to act like I know it, but it makes me nervous.
Yeah. Well, plus you're adding, we just have particularly Americans, we take more pills than any other people in society, right? Which is questionable both on the cost and the efficacy side when you start to imagine the number of medications that Americans take versus everybody else in the world. And we're not necessarily healthier. So I think we just got to trade carefully here.
Yeah. Okay, and then about Health and Us, sort of a related story to one Marcus and I talked about a couple weeks ago. Nearly 7 out of 10 patients view their test results before they talk to a clinician, and this is sort of a result of maybe the 21st Century Cares Act, that now the patient has a right to see their results, as soon as they're available, and often they see it before the doctor has a chance to call them. It says in here that in the survey, about 6% said they understood the results very poorly. Well, the other 93% either understood them fairly well, or very well. That was the most surprising thing to me in this article. I don't know. What are your thoughts about patients' access to results and whether a clinician should be guiding them or not?
So, back in the day, right, when I was running, maybe a long time ago, one of the biggest challenges we had was getting results from, radiology departments, laboratories, particularly third parties, to the doctors, and then doctors to the patients, right? There was fax machines involved, there was phone calls involved, and hence there were oftentimes delays. And particularly with basic stuff, there didn't need to be delays. I remember when we were rolling out Epic, back in the 17, 18, Epic had this feature where they turned that on, right? The results automatically went to the patient BMI chart. And there was a lot of discussion about that and consternation. There was a lot of debate on the pros and cons versus this. I think that we could do a better job of curating those results, and some of them should. And it is that way now. Like if you've got a terminal cancer diagnosis, like that should hit the doctor first, and it does. And Epic has ways where they flag that, gives the doctor 48 hours, and maybe we need to go through and curate those more. I still think it's probably better than not. The patients get their results. Yes, it can cause consternation. They may not be able to understand it, but that's better than delays. And, it serves them. It's their information. They own their medical record. They should be able to know. The other piece of it is I do think now with tools like you say you get your lab results and you don't understand something, they have a lot of clickables, right? What does this mean in layman's terms? Yes, you can use ChatGPT. So I think it's better than not having them, and it's better than it was, but maybe there's a way we can, curate those a little bit more scientifically so that patients aren't lingering on pretty dire diagnosis.
Yeah. I think we're aligned. I think it's better to have patients with access to their own lab and image results. And it would be good for physicians to sort of get their operations set up where they can also communicate with the patient relatively quickly, but we don't do that perfectly right
No,
now. So
part of this is up to the physicians and their work. But I tell you what, I go to Vanderbilt, and I get my labs drawn for regular testing results, and oftentimes I'll do that in the morning, and the results are in my inbox by 2:00 with a full report. And so that is light years above where we were, and I wouldn't want to go backwards. And we probably just got to continue to make improvements on the physician piece of it and when they get involved.
Yeah, I agree. Okay, moving into Web3. So Bitcoin had a huge move in the last 24 hours. The article from the block says Bitcoin hit 69,000, Ethereum jumps 10% as Treasury buybacks and the SEC crypto proposal drive a rally. So, and then as we're recording here, we record on Thursdays, it's currently 72,600. So even a little bit over the title. Big move for Bitcoin. Any thoughts about this?
Yeah, maybe hit the next article because I think they're related too, right? I mean, and then we can.
Yeah, so the next article is from Coindesk. Trump is pushing Congress to move on the Clarity Act. He had an event with a bunch of crypto and Web3 executives and companies really calling for Congress to pass the Clarity Act. I think that it's going to be a long road to get the Clarity Act passed from where we are now, but it would be great to get it passed. I don't know. What are your thoughts about this?
I don't know. Is this what's fueling the rise? Is it just the thoughts? I'm not sure I fully understand it if it's still got a long ways to go. I mean, clearly.
I think it's more about,
more about rates?
I'm sure everything has somewhat of an effect. I think it's much more a feeling that Treasury started buying its own bonds, and that is seen as sort of easing and putting money into the system. And a lot of the Bitcoin maximalists feel like that is a sign that, and then we also hit over 40 trillion in debt. So that's a theme in Bitcoin that people feel like is going to drive usage away from the dollar towards gold and Bitcoin. I didn't check gold, but I bet gold is up as well.
Yeah, I see your point, right? Clearly that's a signal that he's worried when he's buying back. When I say he, I mean Bessent, right? That he's buying back. That's sort of a signal. So that probably makes sense more than the Clarity Act and potential regulations. But clearly the fact that there's a deep desire within the administration to support Clarity Act and regulatory and crypto in general is fueling some of this as well.
Yeah, and I think we need the Clarity Act. Yeah. And actually, it's sort of counterintuitive, but Trump and how much money Trump is making from his various coins and ways to profit off crypto is one of the things that's causing delays in Congress. And yet Trump is pushing for it, of course, because he has a lot of net worth tied up in it.
Right.
I think it should pass, but I think I'm not sure that Trump stumping for it is going to make that much of a difference.
Yeah.
Moving into AI. So the FDA authorized first of its kind blood draw robot. This is in Beckers. And so the FDA has authorized now the first standalone robot that can do what a phlebotomist does, draw blood from a patient's arm. One operator can run up to 3 machines. It's currently in use in Europe, so we are following Europe. And I found a video we'll put in. You can see it here. You put your arm into the machine and kind of grip the little holder there, and then it comes down and draws blood. It's a pretty interesting video to watch. It makes it seem much more approachable. It's not humanoid robot like walking over to you with a needle and starting to jab towards you. But still, it's a turning point where we start to now have automated robotics doing jobs that humans used to do. Phlebotomy is a hard skill, and it's hard to find people to do it. That's right. I don't know. What are your thoughts?
Yeah, I think you hit it right. I think anybody who's had a negative experience with phlebotomy, had multiple pokes, they either look at this as, wow, I can avoid that, or holy cow, now I'm trusting it to a whole nother robot. What if the robot goes crazy, hallucinates, and I get poked and blah, blah, blah. But I think your point's the right one, which is it's really hard to find these people and there's not enough of them. And so if there's a way that we can in a reasonable cost standpoint, be able to supplement those people, then that's probably a positive thing overall. It's a little scary to think about getting blood drawn. And I'm wondering what those people...
I was really scared of it until I saw the video, and then it seems much more approachable. I think I would try it. I mean, I wouldn't have said that before I watched the video. So it's much more, I don't know. It seems much more controlled.
It's using some ultrasound technology, isn't it? So
yes.
and I think
it's infrared and ultrasound. So I think it actually eventually might be more accurate than the human, just kind of feeling with their finger.
Right. Well, if you have ever people that are a tough stick in hospitals, they bring in sort of a specialty team, and oftentimes they use this vein finder sort of ultrasound technology that it's not all that expensive, but maybe this can incorporate that and the accuracy is better. So it'll be interesting to see what happens.
Yeah, right. Okay, and then Epic had its user group, UGM meeting in Wisconsin this week, and they rolled out their AI platform. But you've been to these events, so tell me about the Epic event. Yeah. So you didn't go this year, but in general, what's it like? And tell me about the Epic event.
Yeah, I don't go anymore. I'm not in a world where I'm an Epic customer, but I was. And my first visit to Verona, Wisconsin, where the headquarters are, was a meeting with a bunch of doctors and a couple of us operators who were beginning our implementation process. And besides being just an incredible campus, right? It's fun, it's whimsical. We went down the slide. You see guys in suits and doctors going down the slide, and it creates this sort of...
They have like a multi-floor slide, and then several rooms are themed.
They're all themed, a lot of Star Wars type stuff. And but what impressed me most about that visit, and I don't think I'll forget it, was there was probably 20 doctors around the room, and Judy was in the room. And she went around the room and asked the doctors, what they were most excited about, what they were concerned about. She took notes. She knew she had a list of every doctor's name, and she called them by their name and went around the room and she spent time with us. And then, monthly we'd have calls with Judy. I mean, so she listens to her customers, and I think that's what it says. I mean, she is the real deal in my opinion. And the thing that impresses me the most about Epic is, they don't buy anything. They develop what their customers need. And I think what you're hearing from both Oracle and Epic is they're spending a lot of time using AI to improve the patient experience, but also to improve the clinician experience and get these people spending less time charting, dealing with documentation, and more time at the bedside. So, to me, that's the use case, right? And it's not perfect. It will make mistakes, but humans make mistakes too. And this is impressive. This is the right way to be using AI, and good for Epic. I'm always impressed that she listens to her customers and she gets it done. And it sounds like Oracle's doing some of the same things.
Yeah, that's right. We cut it in the prep, but Oracle had launched an AI platform as well on their Oracle Health tool. I wanted just to come back to this article. It says that 85% of Epic's customers are using their AI tool set, and they have several different tools. That seems like a huge percentage to me, but it's just the easy button, right? You already have Epic installed, and so it's right there in my chart, and you add the AI, it makes life easier. They have that sort of captive audience, and they're able to launch new products that make it more and more sticky over time.
Yeah, one of the things they do, I don't know if you know this, Vic, but they give out report cards and stars, gold stars, right? So they compare you to your peers on features that you are using and what best practice is. So it creates this pressure system of, I can tell you, I looked at it and I'd asked, when I got the report, which is an executive summary of where we were versus our peers, the first thing I would do would pick up the phone and call and say, like, why aren't we using this feature? Why isn't it turned on? We have it. And so it creates this environment.
We can see that our peers are using it. I mean, they must be getting value. And so it drives adoption and utilization, which is what they want.
Exactly.
Yeah. Okay. Moving into the broader OpenAI, there were several stories. I chose two, but they are behind Anthropic and working to catch up. And so OpenAI launched a new tool. It's even just a setting for teens, and it's automatic. And so if you are judged by their age algorithm and they're using sort of what you look like and what you're talking about, and if you've given your birthday, of course, if they deem you to be under 18, they automatically put these settings and you can't turn it off. Now, you can argue that, like I would argue I'm 55, but it's not like a toggle switch that you have to fight with a teenager about. Like OpenAI automatically puts it in, and it's meant to be safer for teens, 13 to 17. So I think, this is one of 4 or 5 stories this week with OpenAI kind of trying to come out and being safer, more trustworthy. I think partially because they're behind, and partially because they're trying to shed the reputation for being the fast and loose AI company. And so on that same thread, they now have an enterprise deal where they will let enterprises use the OpenAI ChatGPT product without sharing data back to train on. And so enterprise, because that's been one of the real fears that, if I'm a venture capitalist and I have these ways to screen companies or help our companies or exit companies, if I use these tools, gosh, maybe OpenAI and Anthropic are learning from that and they might compete against me. And so OpenAI came out with these 2 and several other sort of much more business or individual friendly, I guess, policies to try to change their branding is how I think about it. I don't know. What do you think about OpenAI?
Yeah, so the story, what I liked about it, and I'd be curious to track it and see how it actually works, is the piece related to the teens is it stated that it sort of functions that it doesn't just give them the answer. So today they can type it in and they get the answer and move on. It is actually primed and prompted to help them get the answer, much like a parent would. Have you thought about this? Sort of helping them learn versus just giving them the answer. Let's see how that works. But that's a good intent. If that actually does work, then it's an educational learning tool. It's helping them do their homework versus doing it for them. Just like a parent, right? There's a big difference between you and I helping our kids do I stopped being able to do that in 5th grade, but helping them be able to do their homework versus doing it for them. This sounds like it's that approach. So be curious how it works.
Yeah, that's right. So, the combination of it's automatic, meaning if you are a teenager, you can't turn it off. And then if it recognizes that you're working on academic work, it shifts automatically to what's called study mode, where yes, it sort of will help you come up with your thesis for an essay, but it won't write it for you. It kind of walks you through the steps to work on a problem as a tutor would or as a parent would. And that could be really positive.
Right.
Because, we need a lot of help in our educational space. There just aren't enough teachers to go around. And sometimes students are working at 9, 10, 11 o'clock at night, and giving them support while not giving them the answer could be really good.
Yeah. I think it's going to be fun to watch. It could be really positive.
Okay. And the last story, Amazon is now expanding to 500 cities to do drone delivery. And so they will be delivering groceries, packages, electronics, I think anything that Amazon sells within 30 minutes in 500 cities. They currently operate in 11, so they're expanding pretty dramatically. Chicago, Atlanta, Cleveland, Syracuse, Boise. They're already in Phoenix, Detroit, Houston, and there's 500 more. What do you think about this? I'm not sure that there's that many things I need in 30 minutes.
It's
but
so
I guess
fast
convenience
already.
Is good. Yeah, exactly. It's already next day for most things, but maybe I'm a Luddite. I don't know. I guess it's cool, but I don't know if I need my chips in half an hour.
Well, will it bring down prices, right? Will the cost of drones be cheaper than paying for drivers and with everything you got to, and will it take people off the road? Because you see a lot of drivers drive around Nashville. You can't drive 5 minutes without seeing an Amazon driver. So, if it has the effect of reducing costs to consumers and getting the congestion off the roads, then it's a real positive. But I'm with you. I'm not sure that its speed is necessarily. I think this is Amazon's way of reducing costs and getting, robots to do the work of humans, which is not necessarily a bad thing if it gets people off the roads and brings down the cost.
Yeah. Especially a job like a factory work, the pick and pack worker, or driving all around the city delivering packages. I'm not sure those are the most fun jobs for humans to do. So if we can do that faster, less expensive, more safely with drones, they already are doing that in their sort of not manufacturing, but sort of pick and packing plants.
Use a lot of robots.
They've been successfully. Yeah.
I thought this would be in rural communities, obviously, but it's not, right? These are, and maybe that's the reason, is traffic is a killer for their profits in those places, because they're spending a lot of time behind the wheel. But I would assume that it would have been more rural places, but Chicago, Atlanta, Cleveland, Syracuse, Boise, are not rural communities.
Not that. Right. Yeah. Yeah. Well, those are the stories. Paul, thanks for doing this. It's another, there's always, every week, there's a lot of stories. I appreciate you walking through them with me.
Yeah, my pleasure. Be well, Vic.
Okay. Thanks, everyone.